Hello and welcome to the AbstractMedic YouTube channel. Make sure you like, comment and subscribe. So today we're going to be talking about how to do well in the UKMLA/AKT examination. This exam is usually sat in the final years of medical school. I sat it as a pilot in my final year of medical school. So it was basically a pass-fail because it was a pilot. It didn't count to my final score of medical school. Years 1, 2, 3 and 4 did count to my medical school grade, but Year 5 was the UKMLA pilot and it was pass-fail for me. So I have experience in having sat the exam and what it's all about. So I'm just trying to help you guys do well in the exam, think about how to prepare and how best to prepare. So first and foremost, I've already done a part 1 and part 2. So if you haven't seen it, I suggest you go back and just have a quick listen and have a quick run through of the video just to get an idea of the different tips that I've given there. But today I'm mainly going to talk about how I personally prepared for the exam. I would consistently score 80% and above in my university exam, and in the UKMLA exam/AKT exam I also scored 80%. So I think I'm in a decent position to, advise people how to prepare for the exam. So when it comes to actual technique, I feel like what's important is about how deep your knowledge goes as opposed to how vast your knowledge is. What I mean by that is that it's important to know how to treat all the different lines of asthma or COPD, both asthma as a condition and also during exacerbations. Same with COPD, as opposed to knowing all the different respiratory conditions that there are in the world. You're better off just knowing the depth of what it is to treat an asthma exacerbation and knowing the different severity types. My first advice would be to go through the AKT/UKMLA content map and look at the conditions that are listed and think about knowing them and knowing them well, as opposed to knowing everything briefly, because knowing things well, knowing the 3rd, 4th line treatment of certain conditions is what's going to get you those marks. And also knowing what's important, knowing the kind of things that you'll see as an F1 doctor and what you're expected to know. For example, if you're in an emergency department, what will come in? What are you expected to know? The common things. So common things are common is something that I heard a lot in my first year of medical school, and I didn't understand it. And then one day it just clicked, like literally overnight. It's like the common things are common and these are the things that you're expected to know. So when it comes to actually preparing in terms of techniques, people use flashcards, people use audio, podcasts to learn. Me personally, to do really well, what I did is I used music, like I'd make R&B remixes. You can go to my YouTube. I have a playlist of R&B remixes that help me so much. Even to this day, I'll be remembering the different lyrics to the songs and I'll be remembering how to manage random things because of, I don't know, there's just something about music that just sticks. Think about a song that you heard like years ago. You still remember it, right? And even sometimes you might forget a bit of the lyrics, but you only have to hear it once again and it will come back to you, right? So I figured, let me just hijack that and use that as a memory tip to help me. And it helps me. So if you guys want me to like formally record these remixes, then I can do. But if not, then I just have them on my YouTube playlist, or you can check them out on my TikTok as well. I also drew a lot of things because I have like a photographic memory, which is something I kind of noticed in A-level times, but I didn't really capitalize on it. Nor did I capitalize on it until my 3rd year of biochemistry, because I did 2 degrees, biochemistry then medicine. So it wasn't until my 3rd year when I realized that actually, you know what, this is a really, really effective method for me, because I could remember things really, really well with just drawing. So I draw a lot. And also important is question banks. Question banks, the thing is, people can be smart, but if you don't have the right exam techniques, then it's not going to translate. So question banks, like I said in my part 2, I think, are very important. So make sure you jump on the question banks. But yeah, that's a bit more about how I got 80% in my UKMLA AKT exam. If you want me to share even more tips, I probably will just continue to make videos about it because I feel like it will be helpful to someone. But yeah, make sure you like, comment and subscribe, guys. And yeah, comment, let me know whether this was helpful, what you want me to cover. I want to try my best to help you guys out because med school is tough. People have been through it, people have done well, so why not help people out, So yeah, bye guys. Make sure you like, comment and subscribe.